Brad Calobrace here. I'm here with good friends Jason Pozner and Jonathan Cook. And I wanted to ask you guys about the new FDA approval of the Juvederm Volbella for the under eyelid tear trough area. Who's doing it? Are you guys, Jason, are you using fillers as part of your treatment for lower eyelids?
Yeah, I probably do a couple a week where my other people in my practice don't like to do that too much, so they send them all to me. So I like fillers for lower eyelids, and I've been using Belotero. You know, right now the new approval was Volbella, and it's on label for Volbella, but I don't like that Vicross technology.
Yeah.
It's led to a lot of bumps. We actually stopped carrying it in our practice. We have everything else but these Vicrosses. So when I heard about this approval, I'm like, ho hum, I'm gonna keep using Belotero.
Yeah, Jonathan?
Yeah, I think it's important. You have to select the right patient whenever you're using filler. I also personally don't like the Vicross technology. I think something that's very low viscosity, like Belotero, low Tyndall, that's what you should use under the eyelids.
Yeah, I do a ton of lower eyelids because we have a big med spa and they all get funneled to me to do these, which I think are a little bit more challenging at times. But so I was glad to see the FDA giving some approval for lower eyelid treatment. I tend to use Restylane in the lower eyelids because it has the lower Tyndall effect, as you said. So beyond fillers, what are you guys using for lower eyelids? Maybe each of you, what is your favorite sort of treatment for the lower eyelids?
Yeah, mine is like no question. I do a ton of these a week. Laser resurfacing of lower lids. I had it done to me with or without a transconj bleph. It's just an amazing procedure. Yep. I mean, you look like crap for about a week, but it's amazing for tightening.
Yep.
And Jonathan?
Yeah, I mean, also a huge fan of the laser resurfacing lower lids. I also think that the technique that you were talking about earlier with the lower eyelid vein, that's a good technique.
What is that?
So using a 1064 laser to take out these little feeding vessels oftentimes can eliminate some of the dark circles that you see.
Because dark circles under the eyes in most lighter skinned people are vascular. In darker skinned people it's often pigment, so we need different technologies to treat that.
Totally, and I've used the XLV in those lower eyelid vessels because they bring in that tint of darkness to them. Yeah, I've always said dark circles are hollowing their pigmentation, their vascularity, trying to figure out which of those elements you're treating guide you to what's to treat.
Exactly.
So you think anything in the future? So you guys both know technology a lot and emerging. I know, and laser resurfacing is great. Anything emerging that you can think of? What?
Yes. We've been working on a project now for 2 years now, and we just got approval at the ASLMS meeting. So by the time we publish this will be public domain. We are actually doing laser skin excision, laser microcoring of lids.
Oh yes.
With the Cyton laser. It's actually taking out diamond shape of the lid. So we measure the lid thickness first with an ultrasound device. We go a little bit past that, and we take out little punches of skin, and we are getting blepharoplasty-like results with no incisions. And for patients who've had previous blepharoplasty, we've been cleaning them up and tightening it up in areas where they might have a little laxity.
Yeah, it's a great tool. There's no surgical option that can give you that kind of a fine tuning. After surgery.
Microcoring, I was at Octane looking at all new technologies just a few months ago, and microcoring and facial rejuvenation, eyelids and stuff is that new hot topic, I think. So for the FDA approval for Volbella, we think it's great for lower eyelids, but not so much we care about whether it's Volbella or not.
Exactly.
True?
It's just nice to have a product that the FDA says is okay, because we were doing it off-label before.
And you heard it here, microcoring may be the future treatment of choice for lower eyelids as well.
And uppers.
Okay, very good. For Plastic Surgery Channel Roundtable, Brad Calobrace. Thank you.